Laura Katz Olson, Distinguished Professor of Political Science at Lehigh University and author of Ethically Challenged Private Equity Storms U.S. Healthcare. Laura, thank you so much for coming on today.
Oh, it's my pleasure.
I should say I went to Lafayette, so we're supposed to have a deep rivalry here.
Of course.
I know I don't really care too much about that, but it is funny to.
It's a big issue. It's a big issue at Lehigh and Lafayette.
It is exactly. So let's just start with the history of private equity. I know that was kind of chapter 2 of your book, but for our audience, I think it would be a great place to start. How it kind of grew out of this era of privatization and deregulation in the 70s and 80s.
Well, it started in the 70s. But it was really very small scale. But it started to pick up in the 1980s, especially because there was a source of very, very, I shouldn't say inexpensive, but a huge source of money, junk bond, by the junk bond industry. And in the early years, it was, they would just sort of take over companies. They wouldn't even negotiate. They would just take over companies, and they were seen as some pretty ugly raiders. One of the most important books on the issue is called "The Barbarians Are Coming," the barbarians are at your gate. They're already here,
right?
And what they would do is they would take some big company, and in those days, these companies would be huge conglomerates with lots of different pieces to it, like cigarettes and cookies and magazines and just, everything all together. And they would buy the whole conglomerate and then sell off the pieces, because the pieces were worth far more than the whole. And they would pocket, of course, all of this, and they were it turned out to be a very lucrative investment for the private equity owners. So that's how it began. They were just basically corporate raiders.
And butchers too, right? In the sense that they were cutting up the pieces of companies and selling them off for parts. And in innumerable cases, these companies will go bankrupt. Right. Yeah. So how did that work? I mean, I want to get into some more modern examples of it as well, but I think people who are learning about this for the first time might say, well, how is there profit in taking on companies that are in such deep financial straits and then selling it off?
Well, that is the myth that has been perpetuated, and certainly was perpetuated by Mitt Romney when he ran for president. They take these starving companies and they make them prosperous, and workers and communities all benefit from this. Indeed, if you look at the playbook, the private equity playbook, they need to take a prosperous company, because for the most part, the companies are paying off the debt that the private equity is putting on them. And in order to pay off this debt, you need to have more and more revenues. And so a disastrous company could not pay off these revenues. So they mostly buy prosperous companies. There's a few private equity companies that specialize in distressed companies, but those are very few.
Gotcha.
And they have a different playbook.
Sorry?
And they have a different playbook, of course.
Right. Do you mind expanding on that playbook? Because I feel like those are kind of the vampires that are most acute, I guess, in terms of the way that they exert their power on certain industries.
Actually not. I mean, There are very few of them, and what they do is they buy distressed companies. Most of the distressed companies they buy were because the private equity firms before them have made them distressed.
Okay. Gotcha.
So they're not really the big problem in the game. The big problem in the game is the private equity companies that are buying these viable companies and stripping them as best as they can and then selling them off, mostly these days, because IPOs are really down right now, to other private equity companies. So it's like serial sales.
And in healthcare, which is what you focus on, when did private equity really start to dip its toe into the healthcare industry, which is what, like 20% of the United States economy, something like that?
It is definitely 20. It's not only 20% of the U.S. economy, but it's a significant. Medicare and Medicaid, for example, are significant percentages of the federal and state budgets. So, like Willie Sutton says, why do you rob banks? Because that's where the money is. And that's why private equity is going into healthcare, because that's where the money is.
Lots of money. Unfortunately, I mean, on our show, we're advocates for single payer. So,
let me answer your question, which I didn't.
Sure.
They did a little bit in healthcare in the 1990s and a little bit in the early 21st century. But since 2015, they've just been accelerating dramatically. And as they have more and more what they call dry powder, should I explain what that is?
Yeah, go ahead.
Okay. Public pension funds, university endowments, and nonprofit endowments, they are the major investors in private equity. And they have invested in these private equity firms. I'm sorry, I lost track of what I was.
You were mentioning how what dry powder is. Yeah.
So they started to get more and more dry powder, which is the money that these investors are giving them, and they have to spend it. And so this money is growing and growing, and the money is sitting there. And they finally decided that, hey, healthcare has a lot of benefits to it, including the fact that it's very profitable. So by about 2015, they started investing seriously in the healthcare sector.
And this is probably around the same time that some of these pension funds begin to move more into the stock market and into the investment sphere. Is that correct?
Well, these pension funds started moving away from the stock market to private equity.
Right. Okay. Yes. Gotcha. Okay.
And I just read this morning that there's an average of about 14% of their, and this is just an average, of their pension fund money now is in private equity. And they keep investing more and more money.
Is it because they perceive it as less risky?
It's definitely more risky.
Right, but the perception might be that it's less but based on your research, it definitely seems more risky.
No, it's definitely more risky, and another problem, it's illiquid. The private equity fund keeps this money for decades. But the reason they're investing more and more is because they believe, and I emphasize the belief, that they're getting high rates of return. There is a growing number of studies now showing this may not be the case anymore. It's very, very hard. Private equity is very secretive. It's very hard to get any information, including the investors get very little information.
Right. Well, you were struggling to get anyone to kind of give you more information for your research as well. on this side. I know you wrote a bit about how secretive they were in you trying to get in the process of your research.
Well, they make all of the businesses that they buy sign non-disclosure and non-disparagement clauses, and at the risk of losing the money that they were given. So people are very, very reluctant, obvious reasons, to talk about the problems that they experience once they've sold their small business. A lot of these small businesses in healthcare, whether it's autism or eating disorders or drug and alcohol rehab centers, a lot of the original owners really care about the issue and really care about their patients. And they don't understand. There's a lot of naivety among physicians, for example. They don't really understand what they're getting into, because they're told that what the private equity firm is going to do is take care of the annoying stuff. And there's lots of annoying stuff with rules and regulations and handling, patient times that they're coming and all of that. That's all going to be taken care of by the private equity firm, so as to allow the, let's say, physician or provider to practice what they want to practice. It's a big thing. They let physicians practice medicine. But the reality is they are totally controlled by the private equity firm.
Can you expand a bit on the point about how private equity is targeting places like eating disorder centers, rehabilitation clinics, autism treatment facilities, because there's a little bit less government oversight into some of those facilities, and they've, I think, been, and correct me if I'm wrong, targeting them for that particular reason.
Well, one of the reasons that they're targeting healthcare, obviously, is because that's where the money is. That's where the profits are. The aging population, the Affordable Care Act, which put more patients on the, but also healthcare is fragmented. I mean, lots and lots of small agencies, mom and pop shops, that what they'll do is they'll buy what they call a platform, like a flourishing company.
Mm-hmm.
And then they will add on to that company by taking on these small mom and pop shops or agencies, buying those companies and making it larger and larger, which increases the value exponentially, but also gives them local, regional, state, and sometimes national monopolies, so that they can control the costs.
Gotcha. And
can I just say one thing, which if
sure.
I don't get in, it won't, because this is one of the most important things. When they buy a company, the private equity firm puts in about 2% of the value, only 2%. The pension funds and endowments put in about 38%. And the rest of that is paid for by debt. Now, the debt is paid back by the companies they bought. So whether it's the large company, which is the platform, or the add-ons that they buy, it's the companies, not the private equity firms, that pay back the debt. And I think it's important to understand that.
So if I'm not mistaken, that seems like a much shakier business model than advertised, right?
Oh, yeah. Oh
Like
yeah.
that's a crumbling foundation. I mean, I don't want to say it's robbing Peter to pay Paul because that's a little bit too extreme, but that
No,
there's no, it's not.
I don't know if it's too extreme. I
Okay.
mean, they're going out and buying this company and then telling the company they have to pay back their own debt.
Yeah.
And by the way, that's why they need a flourishing company. But I think the significant piece is that in order to pay back this debt, they have to make huge cuts to increase revenues.
Right.
And that's where it gets very, very scary in healthcare. For example, they'll speed up the intensity of care. So the physician who used to treat 10 patients now has to treat 15 patients an hour. They'll cut back on materials, which, of course, is a big deal in healthcare. They'll cut back on training. They'll
Yeah.
even cut back on the number of physicians and put in less trained substitutes. They'll have these untrained people without a lot of supervision. I mean, there's all kinds of things that they do to increase revenues so that they can pay back this debt. And then they sell the company 5 years later. And now they own a company with no debt, for the most part, but lots of value.
Yeah. I mean, I have a theory that this is also happening in tech right now. That a lot of these companies that are trying to get acquired, they're cutting costs very quickly so that they can sell their brand and get a big payout for the executives, and then the company is gonna get acquired, and the workers, it doesn't necessarily matter. I mean, I want to return to how this affects the patients in a second, but workers in these fields in healthcare are also affected by this as well. And can you just expand on the layoff element when they're trying to make the company as profitable or as squeeze as much juice out of it as possible?
Well, yeah. I mean, they'll have fewer workers, of course, fewer high-paid workers like physicians. They'll often slash the salaries. They'll slash benefits, slash sick days. So it has very detrimental effect on the workers
Right.
in healthcare. And as a result, the patients, because in many healthcare fields, it's the workers that are really there for the quality of care. When you start messing around with the workers in healthcare, if you mess around with the workers in retail, so it's annoying. You go to the store and you can't get someone to help you. But in healthcare, it can cause illness and death. So it's a pretty different issue.
Absolutely. And the you also speak about how this has affected dental service organizations as well, and how that's kind of how they dip their toe into this area. Do you mind talking a bit about that?
Well, they use the same playbook with dental services. They've had disastrous experience with dental services in the 1990s, but some of this is ongoing. They've had bankruptcies. They've had Medicare, Medicaid abuse. They had seriously abused young children with the dental care. But some of this is ongoing. And my favorite whipping boy is Aspen Dental, because it's still there. It's still growing. It's still very profitable. It's gone through, I forget how many, I think 5 changes of hands for private equity. But this is to have long, ongoing abuse of patients, abuse of Medicaid, abuse of everything, and yet it's still going. And they just got sued by Massachusetts for fraud, and Massachusetts won, and yet they're going and going. And there's people still go to Aspen Dental because they don't know.
And are they so they're growing and as we speak?
Yes.
Wow.
And if you look at reviews of Aspen Dental, you can see, one dentist wrote, I had to leave because all they do is try to talk people out of their teeth. But if you look at the reviews that I did, like an Aspen Dental among patients, it's pretty scary. And these are patients who went for second opinions.
Yeah.
And yet, what amazes me is that they still are going on.
It is amazing, and especially when you see and you read about the way that the doctors and the workers feel after this kind of squeeze begins to happen. In your interviews with people, what were some of the through lines that you found?
I'm sorry, I didn't. What was some of the?
When you're speaking with doctors who have to work under these conditions with private equity, other workers at these facilities, what were some of the things that they had to tell you?
Well, actually, as I said, very few would talk to me. Or those who did were very cautious because of these non-disclosure forms that they had to sign. But the thing that I think most stood out to me was how surprised they were at the deterioration of care, how badly their workers were being treated, workers that they had hired. And just how this beloved place that they had put together as a founder was disintegrating right before their very eyes, and many of them just leave.
Makes sense. We've covered some surprise billing stories on this show. What is the role of private equity in some of these surprise billing statements that patients are receiving? That have honestly been in the news fairly consistently over the past few years.
Huge.
Yeah.
Private equity, Envision, I forget the second one. There's two major companies owned by private equity that provide emergency physicians. And they are one of the main causes of surprise billing. Another one is medical transportation, aircraft. So when they swoop down and pick you up to take you to a hospital when you're in a car crash or something, that's private equity, a great deal of that, and have huge surprise billings. This is now, we have the Surprise Billing Act now. But one of the things it doesn't cover is ground transportation, which private equity owns a good deal of. And there's still some huge problems with surprise billing. But the role of private equity, especially and including the emergency physicians, is pretty serious.
It sounds it. I mean, what happens when a patient receives a surprise bill from private equity? What does that look like for a patient?
Well, right now, they're not really, in most places, that they're not going to get surprise bills anymore because the Surprise Bill Act has been enacted. What you're going to have is a huge controversy between the insurance company and the private equity-owned company. And the Surprise Billing Act did not really satisfy that issue. So there's just ongoing controversy between them. But the patient in most of these areas, not ground transportation and some others, is much more protected right now.
And still, though, this problem seems to be worsening in other areas. I mean, what are, big picture, your biggest alarm bells that you'd like to sound in terms of the role of private equity in healthcare?
Well, I think the huge alarm bells are one that they have this growing amount of money, dry powder, that has to go somewhere, and it's going into healthcare. And the number of places that they're buying, like I just read today, that huge amounts of money is going into fertility clinics and women's health care. But they're buying very rapidly, and they're taking over, not slowly anymore. It used to be slowly, but now it's pretty accelerating. A great deal of our health care, our physician offices, our gynecologists, our dermatologists, that's a big one, ophthalmologists, and that as they take over more and more of these healthcare niches, we're going to have one, growing costs, and two, lesser quality of care. And one thing, I know I'm a very strong advocate of single payer, Medicare for all of that. But you can't have a single payer system or a Medicare for all system even if you keep the same provider system, because then you'll just have a better payer system, but a worsening delivery system.
And to kind of return to what you were saying at the start of our interview, you see how this system exploits Medicare and Medicaid already.
Well,
you know what I mean?
Yeah, almost all, and I can't think of any exceptions, of private equity investments in healthcare have significant streams of money from Medicare and Medicaid, and some of them are totally funded by Medicare and Medicaid. For example, hospice is totally funded by Medicare for the most part. So yes, what we're doing is we're taking our taxpayer money and putting it into these private equity firms that are literally pocketing it. And if you look at the list of billionaires in this country, a significant and growing percentage are private equity, titans.
That is terrifying, but really necessary for you to get the word out. And I would highly recommend the book. It's called Ethically Challenged: Private Equity Storms U.S. Healthcare. Laura Katz Olson, Distinguished Professor of Political Science at Lehigh University. Thank you so much for your time today, Laura. I really appreciate it.
Thank you for your good questions, and it's been a pleasure.
It's been a pleasure. Really appreciate it.
Bye-bye.
Bye-bye.